when a patient's moving into Invisalign aligner treatment after the ClinCheck process, they are often involved in conversations around risks associated to their treatment. It's really important to us at the practice that we always have those conversations. So 2 things that often can come up for patients are a discussion around 1, black triangles, and 2, a risk associated to treatment being root resorptions. Katie, can you explain each of those in a bit more detail?
Yeah, so a black triangle is a small space between the gum and where the teeth contact. So it's sort of up by your gum line. We'll show you a picture.
Yeah.
And you're most likely to develop a black triangle if you are straightening crowded teeth, because where the teeth were previously overlapping, there isn't that triangle of gum, so when you straighten them, it's not there. Or if you have triangular teeth and your teeth contact towards the tip of the tooth, you're more likely to have a triangle towards the gum. Or if you've had previous recession, you don't have much gum there. In some cases, we can predict when it's more likely to happen. And in some cases, it's one of the risks that can happen with moving your teeth around. Options for it, if it's not in a visible area and it doesn't affect you, it's not a problem. You can just clean in that area. Some people naturally have black triangles anyway. If you don't like the appearance of it, you can have the option to have it camouflaged by carefully bonding composite in that space to fill in the space so you don't have a black triangle.
Fantastic. And what about root resorption?
So root resorption is the shortening of roots of teeth. It is a common outcome with any type of orthodontic treatment, so any type of movement of tooth. In most situations, if you look at my little Sharpie pen here, most teeth have got a tip on the end, and as you move the tooth through the bone, the bottom bit can just blunten slightly. So it's quite common with any type of orthodontic treatment to lose maybe 0.5 millimetre off the tip of the tooth. That's fairly normal. You wouldn't notice any difference. You might just notice it if you were to measure it on an X-ray. It does not affect the prognosis of the tooth. In very rare circumstances, you can have significant shortening of the root of the tooth, which has more severe implications. It is not common. The risk factors are if you have a tooth that's previously been traumatised, so there's already existing damage to the root and then you put pressure on it, or if you're using sort of heavy forces and moving teeth big distances. Usually with Invisalign, you're not using heavy forces and not moving the teeth that far, so it's quite a good option.
Thank you.